put myself last so that I could now kind of bring together what they're talking about with these dread vector-borne disease of Lyme disease and try to now piece it together with what's going on with vision. But one of the problems in doing that is I have to follow these great speakers. So I have to raise my bar here a little bit and try to do as good a possible job. So we're going to talk about the challenge of early diagnosis and why again are we talking here at NORA? Because we deal with people with neurological challenges, with visual problems, and they're all visual spatial problems for the most part. And Lyme disease causes visual spatial processing problem. So I want you to take a look at this video. Oh,
Hi, my
Mary.
name is Marisol
We already saw
Thomas.
Mary. Thank you, Mary. I wanted to mention that Marisol Thomas and Rob Thomas started a foundation called Sidewalk Angels, and it's a rescue foundation for animals. So she has just joined Sidewalk Angels with the Global Lyme Alliance, and they're now going to be doing a joint program about Lyme disease in animals. Why is that important to us? Because often our own pets bring in the ticks that infect the humans. And hopefully NORA is going to be establishing a relationship with the Global Lyme Alliance, as well as we've already done that with iLads. So now going to this one. Yes. Come back and put your hands on the wall.
Not there anymore.
So what did you see? Describe that patient. Let me know about the posture. What do you think about what that problem is? So you have increased flexor tone. Flexor tone because she's dropping into the steps. Spasticity almost, but it's flexor tone. Capital extension, head jutted forward. The tone was so high she could barely talk. She couldn't get a breath in to get the air up through the vocal cords. Lyme disease patient. But she didn't know it. She was referred to me with a concussion. Tested her out, found findings on a visual evoked potential, tested her for Lyme disease, she was positive. So we're going to see where this goes. Tick-borne disease is the great mimicker. It mimics traumatic brain injury, multiple sclerosis, schizophrenia, depression, psychiatric disorders, cardiovascular problems, tumors. It causes convergence and accommodative insufficiency. That's why this disease is so often misdiagnosed. To really understand what we have to do with this, we have to go beyond the symptoms. We can't classify depression. We can't classify conversion disorder, as Judy was mentioned. We can't look at all the characteristics and say, well, that's the problem. Yolanda Foster, you may have recognized her face from one of the TV shows that she was quite popular with. She has Lyme disease. She wrote a very interesting book talking about all the visual symptoms that she had for years that went misdiagnosed as visual problems. Again, she did vision therapy. She also went to many neurologists, missed it, and she has chronic Lyme disease. Optometrists and ophthalmologists are seeing these patients over and over again, as well as neurologists and primary care physicians, and we're missing them. The bullseye rash certainly can be an indicator that this is a condition of Lyme disease, but I've had many patients that have come into my office that had a bullseye rash, went to their primary care physician, they tested, not realizing that sometimes the antibodies aren't present for 6 weeks, came out negative, and the doctor said, well, you really don't have Lyme disease, and let it go. And then it turns into a neurological condition. Here's one of the consequences of the challenges of early diagnosis of Lyme disease is that Much of the country is supposedly doesn't have Lyme disease. I want you to take a good look at the blue states. I have patients that come from every one of these states in the country. Many of my patients, for some reason, come up to me with problems from Texas. Texas doesn't have Lyme disease. In the past 4 months, we must have had 6 patients from Texas that we've diagnosed with Lyme disease through blood tests. How do we diagnose it? We use visual evoked potentials, fundus photography, and OCTA, angiography from ocular tomography. We pick up certain characteristics that are present there, run IGeneX testing and the Galaxy testing for blood tests. I order it. I read the blood tests, and then once it comes out positive, I refer out to physicians that are Lyme literate, those doctors that are within the ILADS group particularly, that understand how to treat this condition. The associated symptoms of trauma and tick-borne disease, and I'm associating this with concussion and brain trauma, are headaches, diplopia, varied blurred vision, photophobia, asthenopia, fatigue with reading, posture and balance difficulties, spatial disorientation, joint pain, dizziness, motion sickness, movement of print, eye strain. Sounds like post-trauma vision syndrome, doesn't it? And visual midline shift syndrome. Sure. These are caused by visual processing problems, and that leads to the characteristics of the binocular difficulties, of convergence, accommodative difficulties, other visual symptoms, and cognitive dysfunction. So the Lyme disease affects the eye. It can affect conjunctivitis, as Tom spoke about earlier, iritis, uveitis, keratitis, Bell's palsy. Those things were all mentioned, and we know the symptoms. Let's go through quickly the bimodal visual process. We know that there's 2. The focal process is non-gravity specific, orients to detail, discrimination, identification, attention, and concentration. It's time present, it's conscious. The spatial visual process, the first one we're born with, links up with proprioception, making it the only component of the visual process that's gravity specific. It's spatially oriented for posture, balance, and movement. It's never interested in time present. It's only interested in the anticipation of change, and it's pre-conscious, unlike the focal process, which gives you the image and the ability to attend to consciousness at that moment. The spatial visual process precedes the consciousness, sets your ability up to allow the consciousness, but the moment you are, it's always giving you the possibilities of the future. It's all about the balance of these 2 systems. The Lyme-related disease compromises the spatial visual process. It affects development with children. It affects learning abilities. It interferes with social cues, cognitive development, many other factors in the adult. It can also interfere with employment. It can break marriages up, many of those things.